The light is solid red. That means I'm on. Hi, it's Friday. The Doctors in Live with TOA is once again in your space. Interesting, this is our 50th episode. Can you believe it? 50 episodes. We kind of started this on a whim just before the pandemic started. And it gave me something to do during the pandemic, and it's been 50 episodes. And I really want to thank our marketing team, particularly Casey, who is my predator, my professional editor, publisher editor, whatever you want. Addie, who's here, who you haven't seen either, who's our face in the community, TOA, and all of our guests, and you. I really appreciate it. Hopefully this is something that will continue to be of interest to you. Hopefully this is something that you find interesting. So again, like we've said before, if you have interest in a topic, comment below. That's down there. Email us, whatever you'd like, and we'll try to get somebody to address those interests. Anyway, I'm Gray Stahlman. I'm your host. The Doc is in Live with TOA is here. Thanks for being here. Thanks for sharing your Friday. Kevin is celebrating, and we're glad he's here as well. TOA.com is the place to go to learn about Tennessee Orthopedic Alliance. We're the oldest and now largest orthopedic specialty practice in the state of Tennessee. We span Knoxville to Columbia. TOA.com can tell you everything about what we do, where we do it, what we can do for you. You can learn about our doctors, you can learn about our services, you can learn about our locations. You can even learn some things about orthopedic care, your body, how to take better care of yourself. Go to our media center link, and we have all of our videos, including all of these videos, our specialty tip videos and whatnot, archived so you can keep watching them if you need to. I mean, you can look at this pretty face all day long if you wanted to. Anyway, I'm teasing. Today, we want to celebrate our 50th show, but we don't have a guest, so you get me. What I wanted to do is I wanted to talk a little bit about a campaign that we have in TOA regarding what's really the best way to have a good experience with your appointment at TOA. For those of you who are patients of ours who have valid email addresses, you should have received an email. It was an e-blast email kind of outlining some of our tips for you to make your experience with your appointment as good as it can be. Nobody likes to go to the doctor's office. Ever since I've been a little kid, the doctor's office has been kind of a nightmare of bureaucracy, paperwork, sit here, stand here, wait for 2 hours, etc. And what we're trying to do is make it as seamless as possible, given the fact that we take care of a lot of people with a lot of different problems. So we kind of came up with this list. Casey's going to put it up now. Of kind of some tips that we have for folks who are new to the practice or maybe who haven't been here in a long time to make your visit as seamless as possible. And I'm going to be looking down here. I've got a little cheat sheet here because I don't want to miss anything or mess it up, okay? So, tip number 1, show up before your appointment time. And what we mean by that is it's actually important for you to show up 30 minutes earlier than your scheduled appointment time if this is a new problem or you're a new patient, because there's some things we need to do in order to get you into our system and make sure we have your information. Getting your insurance information, getting your address, making sure that we have your medication list and medical history. Those things are really important because we can't do our jobs well if we don't have good information. So we don't want people to rush in trying to fill out a form or go online to input this information. We certainly don't want people to rush and make a mistake. It doesn't work if somebody comes in and just doesn't fill out the paperwork and say, just see me, because things can go wrong. For example, if we take somebody to the operating room and we don't know that you are on certain medications because you didn't fill it out, that can be a problem, okay? So number one, show up on time. Show up before your appointment time. My advice to people is, if they say, come in, your appointment's at 9 o'clock with Dr. Stahlman, and this is a new problem or a new patient, show up at 8:30, 30 minutes, okay? It'll help you get through the process better. It'll help us be prepared to help you better. And frankly, it's also polite, because if people are behind you in line and you show up 30 minutes late or on time for your appointment, but really 30 minutes behind schedule, the whole clinic gets pushed back. And that can be a problem, because the doctors have to go to other places. They have to go to the operating room. They have to see other patients and whatnot. And so let's just be polite, okay? One thing that'll be very helpful is if you're running late, traffic in Nashville, around Nashville, Middle Tennessee can be really sketchy sometimes. If you're running late, if you're having a problem finding the offices, give us a call. Don't play radio silence and just show up. Give us a call. We'll do everything we can to get you into your appointment just as quickly as possible. But give us a call if you're running late, and particularly if you're not going to show up. If for something happens, kid gets in trouble at school, you got to go pick them up, somebody gets sick, whatever. If you can't make your appointment, call us. Let us know, okay? That'll make it a lot easier. We won't have to worry about you, and we can make sure that if that slot is going to be empty, we know that we're not looking for somebody. We can move on to the next person. So that's a little tip number one. Number two, and this is an important one. In this day and age, most everybody is on some degree of medication or other, particularly as we get older. There are a lot of people who have half a dozen, or more medications. Because medications have weird names, because medications can sometimes be mistaken for a different medication with a similar name, it's really important for everybody, as best as they can, to have the correct information about your medications. So my advice to people is bring a list of your current medications, including the dosing, how many milligrams or how many tablets, and when you take them, written down. And why that's helpful is because we can go through your medical records, whether it's a new visit or an existing visit, and make sure that everything matches up. Not everybody's medical records from their primary doctor or the hospital gets to all the specialists. Those systems don't really communicate well. And so somebody who comes in and says, well, I've given my medical doctor has this information, I've given him that information. We don't necessarily have any copies of their medical records. And so it's important that if you have medications, you bring the list with you. My advice to you is don't bring a bag of your pill bottles, because what happens if you lose them? You're stuck, okay? It's far better to be proactive, create a list of your medications, and bring that list with you. In addition, if you've had recent changes in your medications, scratch out the ones that have changed and put the new ones in. The medicines that are super important for us to know about, if we're thinking about maybe doing surgery for you, are blood thinning medications, what are called anticoagulants. So some of those are Coumadin or warfarin, Eliquis, Plavix, Brilinta, there's a couple others, major doses of aspirin. Those are important medications for us to know about. Heart medications are also something really important for us to know about. And if you're on steroid type medications, or as my brother-in-law calls it, who's an internist, the IBS and the ABS, these biologic medications that do everything from help people with rheumatoid arthritis to help people with psoriasis, to help people with other inflammatory types of disorders. Those types of medications have effect on people with regard to their healing and their immune system. And so it's really important for us to know those things. The last thing that's important is supplements. Many supplements, there's a gazillion of them, CoQ10, MSM, chondroitin glucosamine, milk thistle, a gazillion things. None of those are regulated. Many of them actually can have an effect on how your body heals, bleeds, or how other medications interact. And so it's really important for us to know about those as well. For example, if you're on a blood thinning medication, which thins your blood to keep you from clotting, we need to know about that. If you're on fish oil or vitamin E, those too can keep your blood from clotting correctly. We need to know about those too. So, because they're anti-inflammatory medications or supplements. So it's really important for us to understand what supplements you take. We're not going to be judgmental about it, but supplements that you take and prescribed medications. The last thing about medicines is over-the-counter medications are medications, okay? You may not have a prescription for Tylenol, aspirin, Advil, Aleve, but they are prescription medications that can have an impact on, or they're non-prescription medications that can have an impact on your medical care. So I ask people all the time, so have you taken any medications for your problem? No, I've not taken any medications. And then I've asked them, well, have you taken Tylenol or Advil? Well, yeah, I take Advil on a regular basis. It's important to understand that non-prescription over-the-counter medications are still medications, and they can have an impact on your care. So those are important as well. So bring a current list of your medications. Third, if you've been recently evaluated by somebody else for your current problem, say for example, you have back pain and sciatica, and you've seen your primary doctor and they did an MRI, or you even saw another surgeon and they did an MRI and recommended treatment, but you're coming to see me for a second opinion, for example, primarily within the last 6 months or so, it's really important for you to bring a copy of the medical records that are related to that particular problem, and especially the imaging, the pictures. So for example, somebody comes into me who's seen their primary doctor or seen somebody else, they had an MRI of their back. Me having that MRI in front of me allows me to give you a better experience, a better examination and opinion. If we don't have the MRI, we've got to do one of a couple of things. We've got to go get it, or have you go get it, because we're not allowed to go get it ourselves, or we have to repeat it. And if we have to repeat it, that can cost you more money, and it may get denied by your insurance company because it's already been done. Now, it's important to understand, because a lot of people go to their primary doctor or even a specialist and they say, you're going to get my records to Dr. X at TOA, right? Sure, we'll make sure they just get there. They never get here, okay? It's really important that if you have medical records and imaging, that you have them in hand, okay? The way the electronic medical record systems in this country work, they don't communicate well with one another. So your doctor can't send us electronically your records. Your doctor, if he's gotten an MRI, cannot easily send the records. He can send the reports, but he can't send the disc itself. To see the pictures, we need to have the data, and that usually comes on a DVD or CD disc. So if you go out to some place and have an MRI done, make sure that you ask them for a copy of your disc containing the pictures so that we can look at those. If you've already had that done, you can go back to that facility and request that to bring with you for your appointment. So previous imaging and records pertinent to this new case, usually within the last 6 months. If it's 10 years ago, it really doesn't matter. 5 years ago, 1 year ago, probably doesn't matter. But at least 6 months is a good idea to get those records and have them in hand so that we can go over that together. It will really make your visit more streamlined, more effective, and more efficient for you, and perhaps save you some money and time. Fourth, bring your identification, okay? We have to know that we are dealing with who you say you are. It's kind of part of our responsibility. It's a responsibility to your insurance company. It's a responsibility to us to protect your information. It's really our responsibility to you. So bring a picture ID, whether it's a state ID, if you don't have a state ID, a passport, those types of official governmental ID, bring a copy so we can make a copy of it and get it in your record so we can match everything together. That's really important. So number one, show up before your appointment. Let us know if you're not going to show up. Number two, medication list. Number three, recent imaging pictures and reports and medical records for your identification. Okay, number five, we're almost there. Insurance information. TOA takes most every insurance plan, but not everyone. In order for you to file this claim on your insurance, we have to have proof of insurance. We have to have your identification card from your insurance company that gives us all the numbers and such to tell us that yes, you are covered by this insurance plan. We go through a process of what's called verification of insurance. If you come to the office and you're a new patient, we've never seen you before, or perhaps you've been seen by us years ago, we need to have that information in order to get your case processed. If you don't show up with the ID card, that can cause a substantial delay in your seeing somebody. And in fact, in some cases, because insurance companies are big, faceless companies, and the telephone is always busy, we may have to cancel and reschedule your appointment if we can't confirm the verification of your insurance coverage. So we want to see everybody. We want people who have insurance to make sure that it's as seamless as possible. And so bring your identification card. Remember, first of the year, lots of people's insurance plans change. I got caught like this. I was scheduled for a test in December. The test happened in January. When I showed up for the test in January, they said this hasn't been approved because, knucklehead that I am, the insurance changed January 1, and so it needed to go through that process again. So January 1 is a big time frame where things change. So if your insurance plan has changed at your employer or whatnot, make sure you have the updated information. And we check at least every year and usually every visit to make sure that everything's up to snuff with regard to that, okay? Last thing, and this is really important because most people know when you get to the doctor's office, your brain kind of shuts off, okay? You're going to get bombarded with questions. You're going to be nervous. You want to get the information out, and you just can't do it. It's a great idea, particularly if you've had a problem that has a fairly complicated history, like, for example, somebody who's had surgery on their back and then had further treatment and has had worsening symptoms, and they had a couple of tests and a couple of shots and things like that. You're never going to remember that if I'm asking you questions. The best thing you can do is write down a list of questions and concerns that you have. Unfortunately, we don't have unlimited time in the office. We want to make sure we address at least the majority of your concerns, the primary concerns, at the time of your visit. We may not be able to get to everything, but we want to make sure we address the most important things. And so it's a great idea if you can bring in with you a list of questions that you have, a list of concerns that you have, And in some cases, a list of kind of what's happened to you, the timeline. It helps you to jog your memory. The providers of TOA don't think it's weird, and in fact, most of us really appreciate the fact that you've taken the time to jot things down because it helps us help you more efficiently, okay? So that's our top 6 list of tips to try to help make your visit with TOA as seamless as we can. We're going to do everything we can to try to help you. You can do a little bit to really make that a more seamless, efficient, and satisfying interaction with just these tips. So we'll go over them one more time. Number 1, show up before your appointment. If this is a new or you've been away from us for a long time, we need to get that updated information. Show up early. Let us know if you can't make it or you're running late. Number 2, lists of your medications. Prescriptions, over-the-counter supplements with doses and how often you take them. In addition to the medications, it's also very helpful if you have a list, and this is good for anything, a list of what your medicines you're allergic to, okay? Because, say for example, you got hit by a car and you can't speak for yourself, but in your wallet you have a list of medications and your allergies. The people in the emergency room can get that without having to speak to you because you can't talk and know something about you. It works here too. So allergies, medications, very helpful to keep an updated list in your personal wallet. Bring that with you. Copies of the x-rays, CAT scans, MRIs, any tests that you've had recently that relate to your current problem, and if you can, medical records associated with those. Okay, that's really helpful to keep things moving along smoothly. Identification, insurance information, and lastly, a list of what your concerns are, what your priority is, and what kind of questions you may have. So that's it. It's pretty common sense, pretty simple. But I'll tell you, I guess fortunately for TOA, unfortunately for everybody out there, we're really busy. Why are we busy? Because there's lots of musculoskeletal problems out there. We see a lot of patients, and we want to be as thorough, efficient, and compassionate to your needs as possible, okay? So if you help us a little bit, it'll make everything move a lot more smoothly. So with that said, I think that's it for the day, okay? Short 23 minutes. Short visit today. Again, thank you. 50th episode may not be the most sexy topic out there, but I think it's an important one. I look forward to the next 50. I hope we've gotten better and better as time's gone on. Again, go to TOA.com, learn about Tennessee Orthopedic Alliance, our services, our locations, what we can do for you. We are working hard every day to improve the interaction between y'all and us to make it a better experience. We're working on developing a more robust online appointments scheduling tool. We're trying to meet your needs. So let's make the doctor's visit as easy as we can, okay? With that said then, thanks again. Kevin, brother, thank you. I'm getting a whisper in my ear. Next week, Dr. Ryan Snowden is back. We met Dr. Snowden months ago talking about scoliosis and surgery for scoliosis. He's a spine surgeon, and next week we're going to talk about something that's actually super cool, which is robotics and artificial intelligence navigation in spine surgery. So how we leverage technology to make spine surgery as safe and as precise as possible. So I'm hopeful we can really have some interesting conversation about that. It's newer technology. Dr. Snowden has a lot of experience with both of those aspects. So come back next week, Friday, 12 noon. Anyway, Till then, go out there, live your best life. Go out there, get your vaccination so we can stop this craziness. Have a good weekend. We'll see you in the next 50.